Welcome back, Best Self Family. It's Dr. Novo. I'm here with Dr. Saluja. We have a great episode for you. We're going to go over our top questions. We have 5 questions that come up to both of us time and time again, day in, day out. So we're going to go over those with you. And then the second portion of the
episode.
And
the answers? Are we going to answer them?
Yeah, I think so, maybe. Okay. And then the second part of the episode, we're going to share with you some questions for fun inspired by Vogue's 73 questions. So you can hear our secrets and then you can play along with us at home. So we are going to start with Botox, and this comes up, you know, people questioning, is it diluted, or how do you make it? Is it watered down, or how do you handle that question about, is Botox diluted?
So Botox gets shipped within, I think, 24 hours from our order, comes frozen. We put it in the refrigerator. It is a powder, so it's coming in powder form, and I cannot inject powder. Right. I haven't figured that out. So the form, this powder form, has to be diluted, or the medical term is reconstituted. And it's reconstituted with normal saline. The manufacturer's recommendation is 2.5 milliliters, and this reconstitution is done daily. It's similar with the other 2 neuromodulators. There's really 3 neuromodulators on the market: Dysport, Jeuveau, Xeomin. They all currently come in powder. They all have to be reconstituted. You know, the goal is to relax muscles that create dynamic wrinkles or wrinkles that are caused from movement. Really, Botox is an art, and so it's less about the dilution and more about the units, where they're injected, how much you need, and also what's going on in your life, right? Because sometimes you have a really relaxed 3 months, and
absolutely,
the Botox lasts longer. Or you have a particularly stressful 3 months, like now, and the Botox, you run through it faster.
Right. So metabolism does come into play.
It does.
As well as just genetics, how you clear it, and aging. Right? What I used 10 years ago or 5 years ago or 2 years ago, depending on how I'm aging, is probably different.
Yeah.
Right. So
the truth of aging is usually you need more maintenance.
Right.
The older you get. I think we all want or hope for less maintenance, but there is more maintenance. And I think some people are lucky and they may need less Botox over time, but that's not true for everyone.
Right.
It's really interesting because the recommended units for the upper face, including in between the brows, the forehead, and the eyes, a full dose was
64
units. 64 units is what's officially recommended. Now, in reality, we end up probably somewhere in the 40 to 50 range, but trying to accomplish what needs to be accomplished in 40 units with 20 units is virtually impossible. Right. And I think sometimes we shoot for maybe numbers that are too low, and we're asking too much with those low numbers. Maybe we need to skip an area, or not really focus in on what we want treated. Right. And I think that's okay. I think it's okay to focus on what you
and get a great result
and not compromise dose. Right.
So if we're trying to spread out a certain financial goal with this huge treatment, we're not going to get the result we want.
Right. If we're doing too low of a dose per area, we're not going to get what we want. So it's really better to what are your priorities? Right. Let's figure out the priorities, dose adequately, and then come back and we can treat another area. We recommend every 3 months. If that's not in a financial comfort zone, then let's do 4 months. Right. If that's not, let's do 6 months. I really would love to not go beyond 6 months, because we lose some of the magical changes over time.
Right, and you get the swings, the peaks and valleys, versus maintaining a constant state of relaxation. So you don't, as a surgeon, we don't form those deeper creases, then we have to resurface, or
right.
So I think consistency is key. whatever's feasible.
You know, you just mentioned resurface. I think one of the other misconceptions is Botox gets rid of all wrinkles. It doesn't.
Right.
It gets rid of muscle. It softens wrinkles created by muscles. It is a medicine that works on muscles.
Right.
So we still have to think about the skin and resurfacing in skincare. We still have to think about fat and bone.
Right.
Those are areas
It's a piece of the puzzle.
It is. It's a fun piece of the puzzle, and no downtime piece of the puzzle.
It's probably highest satisfaction rate too.
I think so. And I think, if it's just wonderful. And if you don't find it wonderful, then I think it's time to communicate, right? Communicate with your practitioner, because I think that's key to any good relationship, including an aesthetic relationship. And things change over time. So what, like you said, what might be working once is not working another time. And sometimes we even switch. We switch from Botox to Dysport, or try the modern Botox Jeuveau. And I think it's okay to do some healthy experimenting with doses and brands to see what you like.
I think you brought up a key point on communication though too, and it's communication and trust. And there really should be no question if you're seeing a practitioner, how are you it really doesn't matter, because our goals are your goals, which are results, and having that trust I think is critical.
Right. Dilution could be 4 milliliters or 1 milliliter. There's many protocols, and those are fabulous also.
Right.
It's
are we
really
getting the results? And we're not happy until we're mutually happy.
Why aren't we getting the results?
Right.
Why aren't we? And we need to explore, and that is communication. And that's one of the things I like to hear from a patient is there an issue? Because if there is, then we can work on fixing it. If we don't know, then we can't, and sometimes adjustments have to be made. That's like
that
with anything.
Botox could be an entire episode.
It could be. But let me ask you a question. Okay. So what does insurance cover for plastic surgery, and what am I responsible for?
So in general, insurance will cover...
Does it cover all plastic surgery?
No. Oh. So it will cover essentially a breast reduction with a thorough pre-qualification exam and history. So you basically have to have large, heavy breasts that are causing you symptoms, neck pain, back pain, rashes. This has to all be very well documented, failed physical therapy, failed medical management, failed weight loss. So we get it approved. Like once you start down that path, appropriate patients do get qualified. So breast reductions, and then usually paniculectomies, or anywhere you're removing a lot of skin.
What's a paniculectomy?
So in the abdomen, if you have a lot of extra skin that's again causing rashes, or this is not an ideal cosmetic result. It's really a relief of symptoms, meaning just, difficulty with hygiene, or, rashes, the same skin changes.
So a large amount of fat in the stomach. It's skin.
Skin and fat, really what you could pinch, if it's hanging down low, what you can pinch together. Insurance will not cover any extension of that. Meaning more
so it's
like
not
an
like
abdominoplasty, right? Tummy tuck or abdominoplasty are considered elective. I usually will tell patients what insurance will and won't cover, and then say, this will accomplish X, Y, Z, but for the optimal goal or aesthetic goal, I think breast reductions work great, but a paniculectomy usually patients are less satisfied. I've had some happy patients. Insurance covers it. They're happy. Their goals were accomplished, but you're not going to move the belly button. You're not going to remove any extra skin above the belly button. It's really just whatever you can pinch below the belly button. I've had insurance cover the similar procedure for thighs if you've had massive weight loss, or anywhere post-bariatric, massive weight loss. Anytime where there's a lot of skin that's really prohibiting, or a barrier to future weight loss or hygiene, really.
Okay.
So everything else in plastic surgery is considered.
What about skin cancer? Can a plastic surgeon remove skin cancer under
We're super busy
insurance
with skin cancer, and I treat every skin cancer case as a work of art. Plastics, I approach it from I want it to be the best scar, minimal scar. I have had that. Aren't you a plastic surgeon? There shouldn't be a scar. And I'm like, well, there's going to be a scar. So I think people have to have reasonable expectations. And usually these are in the center of the nose or cheeks, highly visible areas is usually when they come to me, or skin grafts. And I treat those all like aesthetic procedures.
Right.
Those are
But those
covered
are
through
covered.
insurance. Yep.
What about moles?
Moles, it depends. So if they're symptomatic, if there's any concern from the practitioner, whoever's seen them, if there's concern for
So if
maybe
we're worried about them being
malignancy or
okay.
it's itching, it's bleeding, it's growing, it's painful, there are triggers.
Hurting, okay.
Yeah, hurting. Thank you. Those
So
can be
those,
covered.
okay.
They'll go for pathology. I treat them the exact same as I want the best cosmetic or aesthetic outcome. But if they're benign, we do a lot of that in the office under local. Just remove them because they bother people. They're not changing. They've had them all their life, or they just don't like how they look. So we do
Okay.
both, and then we just do self-pay for those.
When you say under local, you mean injection anesthesia?
Yeah, a
Okay.
little injection of numbing medication in the skin,
Okay.
and we can remove those. There are stitches.
Could I have some nitrous
Usually.
oxide or laughing gas?
Yes,
with
we have
it?
Pronox.
I could, okay.
We're pro comfort, pro
could.
comfort. Yeah, some people just come for Pronox. No, just kidding. It's laughing gas. It wears off. You don't need a driver. I like that over medications, right? Because it wears off. There's no side effects. You don't need a driver.
Okay, so my mole could be removed, or my skin cancer surgery
I would
could use
still numb you,
but
if
then
you
I
want,
could if I was anxious about it.
Absolutely. Yes. I'll be very happy.
I know I'm anxious when I'm in the chair.
Absolutely. Yeah.
not on
that
the
goes
others.
for any procedure.
I like to be the doctor, not the
Laser,
patient.
injectables. You can use the
do it.
Pronox. Absolutely.
Very cool.
I think one of the other most common questions we have are related to Retin-A or tretinoin, some of the vitamin A derivatives. And I want to hear about that. Can I use it in the summer, or why am I using it? How do I apply it? What are the amounts? And I think also distinguishing, retinols are all over the drugstore, but there's a very big difference in what you can get, as we have a in-office store, but it's all medical grade. It is prescription grade medication. So I think there's a lot of mystery around
Retin-A.
Retin-A in general.
So Retin-A is like the dermatologist's baby,
Mm-hmm.
right? Like, we love it. Retin-A is the branded form of tretinoin. So tretinoin is what most of the tubes say now. It's been around for years. It's prescription strength. It's anti-aging and has healthy skin benefits. Medical grade retinol is an alternative, usually not as potent. And Retin-A should be like a lifelong drug once you start it.
Right.
It's a cream that goes on. And I think people like to take breaks or say, oh, I forgot, or I have it in my drawer. And it doesn't work in the drawer.
Right.
That's new. It doesn't work in the drawer. You have to apply it. There's been some talk about how you should use it in the summer or when you're in the sun. And it does exfoliate. So your dead skin is not as thick, right, on top of your living skin. And so you don't get that barrier protection from the sun of the dead skin. But that's what sunblock's for, to protect your skin,
and
right?
smart sun hygiene, like not being out in the sun as much.
It's Florida, though, Dr. Novo. It's Florida. So moderation, sun in moderation, and sunblock, hat, sunglasses. But really, Retin-A is inactivated by the sun, so you should not apply it before you're going out in the sun. And some of those things are
Inactivated?
inactivated.
Okay.
Deactivated.
So you won't, that's why we say
put it on at night.
Right.
It's one of the creams that's important to put on at night, and it doesn't mean that the sun is bad for it. It means it doesn't work in the sun.
That is
so
a
I think
great
that's important to
Mythbuster.
know.
That made the whole episode worth it there. Why do we put it on at night?
That's why we put it on at night. And you should be wearing your sunblock in the morning anyway, and you should be exfoliating your skin anyway. So I think there's a myth that it's thinning out your skin. It's not thinning out the living portion of the skin. It's thinning out the dead portion of the skin.
Right.
It is
thickening
the dermis, the living part of your skin where the collagen resides.
Collagen.
So I've used Retin-A since I was 29, and I'm still 29.
That's right.
And I'm not. So the last 14 years, and it's really one of the best and most studied anti-aging creams available. It's like you're receiving a mild daily peel. There's this period, this 4 to 6 week period when you first start it, that you get what's called retinization. So the skin gets a little pink, it gets a little peely. Not everyone gets it, but some people do, and it's
That's
helping
usually when
your
they give up.
Yes, you got to get through that period. Use it 5 times a week at night. Sometimes if you use it once or twice a week, it's not enough. So you got to use it 5 times
Consistency
a week
is
at
key.
night. And as long as you're not getting itchy or irritated, it's just a little peely and pink, keep doing it. And then usually it stops in 4 to 6 weeks, or we can add a hydrator to it to make it more tolerable. There's a lot of new bases. Tretinoin comes in now that helps with irritation. We can sometimes add a mild anti-inflammatory cream with it to help through this initial process.
Because 4 to 6 weeks is a full skin cycle, right?
Right.
That's how
And then
long
we start,
it takes. And you're going to slough off the old, and then you're going to have
start to get
consistency with the new.
So we got to get to the sweet spot, right? It's kind of like when you're exercising and the squats are still not letting you sit on the potty. So we got to get through it, and then we can still squat and have fun. We can use Retin-A, have fun.
The 2 reasons you wouldn't, I mean, I usually say everyone should be on Retin-A unless you're pregnant or nursing.
Right.
Then it's
right. And some patients with sensitive skin who have rosacea may need to take caution. Some can, some can't. You also have to be careful if you're getting peels, lasers, using depilatories, waxing. You want to stop. Yeah, you've got the sensitive skin, and you really have to stop the Retin-A a week before you can lift more skin than you intended. I think there's there's some sensitive areas on the face, around the mouth, under the eyes, the nasal creases. So we want to keep a pea size. It's a pea size. You use generous amounts of sunscreen, but very small amounts of Retin-A.
Right.
So a pea-size amount of Retin-A, you dab that on your forehead, the cheekbones, and the chin, and then rub it.
Yes,
and you
I'm
really,
doing it right.
You are doing it right. And then you really want to be careful keeping it away from the sensitive areas, if possible. You can use it on your neck, chest, hands, but usually you have to mix it with a hydrator so it's not as potent.
And you really want that to be if not one of the first things you put on your skin, right? So if you cleanse and your skin's still a little kind of dewy,
we put it on at night, first step.
Put it on first step.
Although if you are using like a growth factor serum or an antioxidant, you can put that on first. So serums first, then your gels and creams.
Perfect.
So I think we've talked a lot about tretinoin.
Again, it could be a whole episode.
And
you should be on it.
I have a question for you. Why can't the Retin-A's not working? Why can't I just get a mini neck lift, or like a mini tummy tuck, a mini?
A mini sounds really sexy. Obviously, that's all based in consultation, but a mini is really, 2 reasons it comes up: face and neck, and then tummy usually. So usually a mini is appropriate when you're really just pinching and removing extra skin. So some people it works great for. But if you have deeper structures that really need to be redraped or removed or restructured, then you are committing to a full form of that procedure. Like, for example, for a tummy tuck, I was hoping I could just have a mini that comes up all the time. A mini is really if you just have a little flap or a little pooch hanging over and you don't have any extra above the belly button, and you're just going to basically pinch and remove that little amount that's folding over. It could be fat, could be skin, but you really don't have any bulging or excess from the middle upward. So that's kind of when a mini tummy tuck is appropriate. And then same for a mini facelift, we do those, but it's again, you're not addressing any of the deeper structures like muscle or fat that might need to be redraped or tightened internally. So people do qualify. They're usually younger, or just have really focused areas that you're trying to address on the mini.
Do you think that people think mini means less recovery or less
so.
Anesthesia? Is that why they're wanting, or just you feel
I think
good?
They're optimistic that they don't need as much. I think it feels good. I just wanted a mini, and I do think it connotates like less recovery, less invasive, which it is. That's all true.
What if you get a mini but you really needed more?
I think that you haven't burned any bridges. I mean, I hope that that's our jobs to kind of guide the patient in the best. At the end of the day, some patients I would hopefully say no to if they just wanted a mini and they weren't a candidate for that.
Okay.
But at the same time, if we try a mini, hey, we think this is good, and then you need a revision or more later, surgery doesn't stop aging. People continue to age, and part of it's me, part of it's the patient on how quickly people are going to, if there's skin laxity, if there's skin quality issues, they're going to age faster or need a revision faster.
I think that's an important point, that surgery doesn't stop aging.
Right.
So I think people think, I'll do the surgery and then I'll be done.
Right.
I'll be
Yeah.
set.
Sometimes it's like, I don't want maintenance.
Right.
And I tell all my patients, you're going to want maintenance, whether that's skincare or fillers, and, bones shrink, fat shrinks, skin ages. We don't stop the clock. So that's why we are a practice. We're addressing all those areas.
They say maintenance is the spice of life.
Absolutely. I mean, I'll tell patients before we do surgery, we're going to work on your skin with skincare. Like I need to see that you're committed, because
Right.
the first thing I see is aged skin,
Right.
where they might see this little wrinkle or sagging.
Definitely a combination
Right.
approach.
Right. So that's my approach on that. Did we cover all our top questions? Because we might go to break and then do some
Sculptra?
fun. Oh my goodness, thank
Do
you.
we want to talk about Sculptra?
Yeah. That's on my top 5 of favorite things.
What is
So
it
what
that
is-
my love, not my baby like Retin-A, but my...
You're a Sculptra expert. You do the most Sculptra in Central Florida, if not, would you say all of Florida?
I'd say in the top 3 in
Top
all of
3.
Florida. But who's counting?
Okay, so I've had Sculptra. It's personal testimony. It's one of my favorite. I think it is what they say. It's sneaky anti-aging. It's a secret of anti-aging.
It is.
So could you elaborate on what is it? How does it work? How I might need to do treatments over time?
Okay. And then we'll take a little break?
Yeah.
Okay. So Sculptra is called the secret to modern aging, or as we are calling it, evolved aging.
Mm-hmm.
The scientific term is polyl-lactic acid. It's a skin filler that's not traditional. It's injected as microparticles suspended in fluid. Massage is an important part of post-treatment care. So within days of injecting the Sculptra, the fluid is reabsorbed by the body, and the microparticles begin working to stimulate and replace lost collagen. And so there's some skin restoration and some structural support. And I like to tell patients to think of Sculptra as you're planting seeds in your garden, and these seeds are going to grow, instead of vegetables, they're growing collagen, which is what you want in your face anyway. So you have to give these seeds some time. So optimal results are usually 90 days. Although you might start seeing results in 4 weeks. The goal is really softer contour, so there's less hollowness, less sharpness to the face. We really, when we're younger, one of the reasons we look younger is that we don't have separations between the temple, the cheeks, the jawline, the lips, the chin. Everything sort of blends into one another, and that is our face. And as we age, we start to see these different compartments, and part of Sculptra is part of the goal of Sculptra is to sort of soften these transitions. Sculptra also gives the skin a glow, and there's some volume replacement that occurs as well. So we can use it in some places where we would use filler as the base, as sort of our structure and our support, our foundation, and then we can use filler more sparingly where we need it.
I like that approach too, because you think of Sculptra as almost a global application, and then the filler you can use precisely where you need that direct impact or more instant gratification.
Right.
So
It's
love
a great combination. So having Sculptra doesn't mean you can't have
lips.
filler, or you can't have, Sculptra's not done in the lips, not done under the eyes. Although sometimes when you enhance the temples and the cheeks or restore volume there, the under eyes look better anyway. And I think it's a separate note, but some people are really wanting under eyes filled when they should not. That area should not be filled, or very cautiously filled, or some hollow under the eye is important. So I think Sculptra gives us that global application, as you were talking about. There's some safety in Sculptra, and it's hard to really overdo it because it's your own body that's stimulating the collagen.
I think there's a fascinating history to it as well. I mean, it came around when we were treating people with a lot of volume loss due to certain medications, and there's profound changes. I mean, life-changing revolumization of these patients. So I think it's kind of interesting to know, how it started and just the dramatic results, and then how that translated into aesthetics and anti-aging.
Yeah, Sculptra has been approved for aesthetics for over 10 years. It's one of the tools that specialists have, and it was initially approved for medical reasons for HIV positive patients where the medications were creating hollows in the face that were unnatural. And so people were, HIV positive patients were getting discriminated against because you could identify them.
It's a telltale sign.
You could identify. And you know, that's much worse than aging, which is normal, is being identified as having a stigmatized disease and not being able to hide it because it's your face. So Sculptra was able to help so many people in that realm of softening these hollows so that you looked like everyone else and could start to feel normal again, right? And that's when the idea came, well, if we can use it for medication-induced hollows, why can't we use it for aging-induced hollows? Yeah, very cool.
It's definitely one of my favorite treatments, and I think all the patients that get it look very natural, and I think that's
subtle.
Yeah,
it's subtle.
That's a universal concern is, oh, am I going to look? I want to anti-age, but I don't want, or I want to
look
pro-age
like myself.
Yeah, but I don't want to look, you know, strange or weird. And I don't think any of our patients look strange. I think they all look healthy, just really youthful, natural, balanced. I think it's a great facial balancing procedure too.
It is. I enjoy it.
Awesome. So we will go to a quick break, and then we're going to ask and answer some fun questions, and you can play along with us.
Hey, this is Trisha Schmalhofer, hostess of BAM, Badasses, Alchemists, and Mystics. This podcast is all about seeking knowledge, talking to experts, changing perspectives, channeling wisdom, and shifting consciousness. Listen as we invite a different badass guest each time from a variety of career fields who are living their purpose, spreading light, giving strength and hope, and changing lives every day. We stream live on Facebook, so like our page, interact with us, and watch the behind-the-scenes action. Find BAM, Badasses, Alchemists, and Mystics on Spotify, iHeartRadio, and Apple Podcasts under Space Coast Podcast Network. BAM!
Welcome back, Best Self family. Quick break. We have a few fun questions. Hope that you'll play along with us at home so you can get to know us, play this with a loved one, whoever you want. So these were inspired by Vogue's 73 questions that they would use to interview celebrities or personalities. So we're going to go ahead and start. It's an either-or scenario. So iPhone or Android?
iPhone.
iPhone, too. Okay, same.
Twitter or Instagram?
Instagram. I don't tweet.
Instagram.
Okay.
I don't tweet as well.
Okay, what is your favorite food?
Oh, this is hard. Lots of food. Hot pizza.
I'm the same.
Oatmeal in a jar.
I would say anything Italian. Eggplant parmesan, probably, if I had to pick one food for life to retire on.
Okay, then I'd say hot pizza.
Hot pizza.
Yeah, it would be in the same. Coffee or tea?
Both, but if I had to pick one, tea, herbal tea, loose leaf.
Both too. I feel like both too. Chai or latte.
Both. Herbal tea.
Bad question. Unfair.
Okay.
Coffee and tea.
What is the hardest part about being a mom? We're both moms, by the way.
Okay.
This will be its own episode.
I don't think my kids will be watching, so I can say.
This will be its own episode.
The teenage years, I like to control, and they want none of it. And teenage years, that's the hardest part. In general, teenage and just navigating.
Yeah.
What's acceptable and what's not.
I have a 3-year-old, and she's already telling me I'm a bad mom. So I think it's just that sense. I know in my heart of hearts, but the fact that she even knows she can say, "You're a bad mom because you didn't let me do this thing," so that
She knows.
be just being a disappointment, even though when you know you're not. So we could talk.
You know,
for an hour on that.
we want strong daughters, but then when their
We
strength
create-
is lashed out against
Yes.
you or at you, you're
They're smart and they're strong, and they flip it.
yeah.
I know.
Yeah, we
Okay.
should have an episode on
Mothering.
mothering
We will. Stay tuned for that one.
and our
Ooh, I like this one. If you had I'm jumping ahead because I
Okay.
get excited. If you had a tattoo, where would it be? We're gonna have a tattoo episode.
on my wrist,
Okay.
so I could see it.
That is a pretty spot. Mine would be on my rib cage.
Why?
It's just I think it's pretty. It's
Okay.
hidden.
Okay.
If it's pretty. Kind of like
Have
on
you
the
thought-
side.
You didn't ask the question, what would it be?
I have a sketch.
Oh,
What would it be? What would yours be?
We could.
We're gonna have
Oh.
an episode where we get tattoos. Maybe
Yeah,
next week.
we should do that. A word.
A
I
word.
haven't decided on the word, which
Okay.
is why I haven't done it yet.
But a word.
Yeah. I don't want it to be a lame word. So
That's why there's no
So I'm
tattoo
waiting.
yet.
Or
We
where they
were
get
gonna do a
tired of.
tattoo. Live.
I get close. Get close, and then I decide I don't like the word.
I like this one. To be or not to be?
I had to think about this, but it has to be to be.
Absolutely.
Because
I put all caps. To be.
when it's like 5 a.m., you think not to be, because I'd rather sleep. But then
To be.
to
It's
be,
like to be full of life.
you have to be,
right?
it has to be to be. Okay, so
I
I have
also
one.
okay, go.
What's the best way to de-stress?
De-stress has to be, I think, being outside, being near water. That I think universal is just calming.
And that's why you live where you
Close
live.
to the water.
Close to the water. Laughter.
That's true. Laughter,
For me, that
it
helps
does.
de-stress.
It can
Laughter.
flip any situation.
What's one superpower? you
Okay.
wish?
I like your answer to this, so I was hoping it would come up. Mine would be time travel, for sure.
Where would you go first?
I think to like the 1800s.
Interesting.
Like Downton Abbey era,
Yeah.
1920s.
Yeah,
Those
interesting.
1920s, yeah. I just think it'd be so cool to go back and visit the periods. Like,
See, I have less.
No,
less
yours
interest.
was
The
amazing.
past is the past.
but just to
in the
explore, to come back.
Yes,
I don't want to
yes.
get stuck.
I get it.
I just want to
I
go.
get it. Because history,
explore.
yeah, to explore.
But I
That
liked your
makes-
answer.
That makes sense.
Superpower.
Endless energy, because I feel like that's my, I just run
Achilles
out of
heel.
energy at sometimes. So I just want endless energy. I have a question. If you could master one instrument, what would it be?
Probably the ukulele. I think it's fun and happy.
Very cool. You'll master
And
it.
portable.
That's
portable.
portable. I thought guitar. I was thinking guitar because it's portable as well. Dogs or cats?
I'm dogs for sure, but I'm definitely in a no pet stage because it's one
Yeah.
more thing.
One more thing.
But
dogs.
you're
I have
dog
dogs.
mommy.
I have Hi Simba and Moose. They're more likely to listen than my teenage kids.
Aw. And unconditional love.
Simba and Moose. Yes. What's your favorite flower?
Peony. The peony.
Yeah.
It smells good. It's beautiful.
Jasmine
colors.
for me. So when I was a child, we used to visit India, and temples were open 24, all the time, 24 hours a day, 7 days a week, and the temples always smelled of jasmine.
The smell
and
is
so
amazing. It grows well
jasmine,
here.
yeah, we have it in front of the house,
Okay.
and so
It's beautiful.
Jasmine's just brings me back to childhood.
Yeah.
I like jasmine.
Beautiful scent. Beautiful name. Beautiful princess.
Yeah, right. One more
One more.
question.
It should be good.
Favorite bedtime
I was
story?
going to say that one. Right now, because I just currently, it's the High Five book.
Oh.
It's kind of not a, it's not a wind down book,
Mm-hmm.
but it's just a great story, the High Five book.
Yeah, we saw that at work.
Yeah.
When did the high five work? So
It's
I think at this point for me, any story is a good bedtime story. But one of the favorites when the kids were younger was "Are You My Mother?" And I think I liked it because it made me think of if I wasn't always
sad.
available, though, there's to be somebody
Yeah.
who could be a mother,
Yeah.
right? So there's so
Yeah.
many different mothers,
Yes,
and
there are.
I liked that. It was just like, "Are you my mother?"
Yeah. It is a cute story.
That's cute.
Well, thank you. That was really fun. There are, about 60 more questions. Maybe we'll sprinkle in other episodes, but thank you for listening, Best Self Family. Stay tuned. We have obviously a lot of great content coming up, so we'll see you next time.
Bye.
Bye.